Growing older is a blessing, but with age, our body becomes more sensitive to infections and illnesses. Seniors over 65 need to pay extra attention to hygiene, because what seems like a small neglect today can turn into a serious health problem tomorrow. Daily cleaning is not just about looking fresh, it's about protecting your immune system, avoiding infections, and staying strong enough to enjoy your golden years. Doctors often remind that certain body parts collect bacteria faster, and ignoring them can put your health at risk. Here are the 5 most important areas every senior should wash daily. Hands are one of the most important parts of the body to keep clean, especially for seniors over 65. Doctors say that our hands are the main carriers of germs because we use them for everything from touching doorknobs and handrails to preparing food and even adjusting our glasses. For seniors, washing hands thoroughly and frequently is not just a matter of appearance, it is truly a matter of health and safety. As the immune system weakens with age, even minor germs can cause serious infections like colds, flu, or respiratory illnesses that can take longer to recover from. Many seniors also deal with chronic conditions such as diabetes or heart problems, and in such cases, a simple infection can become much more dangerous. This is why seniors must wash hands with warm water and mild soap several times a day, especially before eating, after using the restroom, and after coming home from outside. Proper hand washing means rubbing all areas of the hand between fingers, under nails, and around the wrists for at least 20 seconds. It is also important to dry hands with a clean towel, because bacteria thrive in moisture. Seniors who use mobility aids like walkers or canes should pay even more attention, because those handles often collect dirt and germs. Carrying a small sanitizer bottle is also a good backup when soap and water are not available. Clean hands not only protect you but also protect your loved ones, especially grandchildren, from falling sick. By making hand hygiene a daily habit, seniors can dramatically lower their risk of infections, which means fewer doctor visits, less medicine, and more peace of mind in their golden years. Face hygiene is another area that becomes extremely important after 65, even though many people ignore it. The face is exposed to dust, pollution, sweat, and bacteria throughout the day. Seniors often touch their eyes, nose, or mouth without realizing it, and this can easily transfer germs into the body. Doctors warn that infections like conjunctivitis, sinus problems, and even respiratory illnesses often begin when germs enter through the face. Washing the face daily helps remove these harmful particles and reduces the chance of illness. Seniors should use lukewarm water and a gentle cleanser that doesn't strip away natural oils, since older skin tends to become dry and sensitive. It is also important to carefully wash around the eyes, nose, and mouth, where bacteria tend to gather. For seniors who wear glasses, cleaning both the face and the glasses daily helps reduce skin irritation and keeps vision clear. Regular face washing also helps prevent skin conditions like acne, rashes, and irritation that can become harder to treat in older age. Another point to remember is shaving or trimming facial hair, since bacteria can collect there if it is not cared for properly. Face hygiene is not only about avoiding illness but also about maintaining dignity, confidence, and self-care. Seniors who keep their faces clean often feel fresher, more energetic, and more socially confident, whether meeting family, attending community events, or simply enjoying their day. Small habits like this bring big benefits, and when practiced daily, they help seniors avoid infections that could otherwise grow into serious problems. Armpits may seem like a private matter, but doctors emphasize that they are a crucial area for seniors to wash daily. The armpit area contains sweat glands that release moisture, and if not cleaned regularly, this moisture mixes with bacteria and causes odor and infections. For seniors, this is more than just a hygiene issue. Bacterial buildup in the armpits can lead to skin irritation, itching, and fungal infections, which become difficult to heal in older age. As the skin becomes thinner and more sensitive with age, neglecting armpit hygiene can cause rashes, soreness, and discomfort that reduce quality of life. Washing the armpits daily with mild soap and warm water is simple but very effective. Seniors should make sure to gently scrub the area, rinse properly, and dry it completely, because moisture left behind can trigger fungal growth. For those who sweat more, using a light, skin-friendly deodorant after washing can also help keep the area clean and fresh. Loose, breathable clothing is another way to reduce sweat and keep armpits healthier. Seniors who are less mobile or who live in warmer climates should be especially careful, because sweat and bacteria multiply faster in heat. By keeping armpits clean, seniors not only avoid discomfort but also reduce their chances of skin infections that could require medical treatment. Clean armpits also bring a sense of freshness, making seniors more comfortable around family and in social settings. It's a small daily habit that makes a big difference in maintaining health and confidence during the later years of life. Private areas are one of the most sensitive and important parts of the body to keep clean after 65. Doctors strongly warn seniors about neglecting personal hygiene in this area, as it can lead to urinary tract infections, skin irritation, and other serious health problems. With age, the immune system weakens and the body takes longer to fight infections, making it even more essential to practice good hygiene. For seniors, washing the private area daily with mild, unscented soap and warm water is recommended. Harsh chemicals or overly perfumed products should be avoided, as they can disrupt the natural balance of the body and cause irritation. After washing, it is important to dry the area thoroughly with a soft towel, since dampness encourages bacterial and fungal growth. For women, maintaining proper hygiene helps prevent urinary and reproductive system infections, while for men it prevents bacterial buildup that can lead to discomfort and illness. Seniors who wear diapers or incontinence products must be especially careful, changing them regularly and cleaning the area gently each time to avoid rashes and infections. Cotton underwear is a better choice than synthetic fabrics, as it allows the skin to breathe and reduces sweat. Another overlooked aspect is hydration. Drinking enough water helps flush out bacteria naturally, supporting hygiene from the inside. By making private area hygiene a non-negotiable part of daily routine, seniors protect themselves from avoidable suffering, reduce medical costs, and preserve their comfort and dignity. Good hygiene in this area ensures confidence, health, and a better quality of life in the golden years. Feet are often ignored when it comes to daily washing, yet they are one of the most important areas for seniors to care for. Doctors often remind that feet are in constant contact with the ground, shoes, and socks, making them a breeding place for bacteria and fungi. For seniors, foot care is especially critical because circulation slows with age, healing takes longer, and conditions like diabetes make feet more vulnerable to infections. Washing feet daily with warm water and mild soap helps remove dirt, sweat, and bacteria that can cause odor, athlete's foot, and fungal infections. After washing, it is crucial to dry feet completely, especially between the toes, since moisture there is a common cause of fungus. Seniors should also check their feet regularly for small cuts, blisters, or sores, because even minor wounds can lead to serious infections if ignored. Comfortable, breathable shoes and clean cotton socks add extra protection, reducing sweat and irritation. Seniors should also trim nails carefully to prevent ingrown toenails, which can become painful and infected. For those with mobility challenges, asking a family member or caregiver for help is better than leaving the feet neglected. Foot hygiene is not only about avoiding illness, it is also about mobility, independence, and overall well-being. Healthy feet mean seniors can continue walking, exercising, and enjoying life without unnecessary pain. Washing feet daily is a simple act, but it can prevent major health issues that affect comfort and independence in old age. By prioritizing this small routine, seniors ensure that their steps remain steady and strong throughout their golden years.